Hello friends, let's see the anatomy of the prostate gland. The prostate is a pyramidal gland which is fibromusculoglandular structure. Here in this figure, this is the prostate gland. This prostate gland secretes acid phosphatase, fibrinolysin, prostaglandins, prostate-specific antigens, etc. And this is responsible for the increase in the bulk of the seminal fluid. This prostate gland is homologous to the paraurethral glands of female. This paraurethral gland is also called as the gland of Skinny. Now let's see the location of the prostate. So for that, let's have this larger image. The prostate gland is situated behind the lower part of this pubic symphysis. It's situated below the neck of this urinary bladder, above this urogenital diaphragm, and in front of this ampulla of the rectum. The size of the prostate gland is around 4 centimeter in breadth, 3 centimeter in length, and 2 centimeter thick. So this is the structure where the breadth of the organ is larger than that of the length of the organ. The weight of this prostate gland is usually 3 grams. Now let's see the external feature of this prostate gland. When we see the external feature of this prostate gland, it has one apex, one base. So the base of the prostate is nearer to the neck of the urinary bladder. One anterior surface, one posterior surface, and two inferolateral surfaces. These inferolateral surfaces we are not able to see here in this sagittal section, and they are situated on the each side of the anterior lobe. So the prostate is a pyramidal shaped structure having one anterior surface which is very narrow, and it is going to be formed by the fusion of the two inferolateral surfaces, one posterior surface, one apex, and one base. But these external features, they are not that much important for the clinical point of view. For the clinical point of view, we should know the lobes of the prostate gland. So here in this figure, when we see the lobes of the prostate gland, they are more important as far as the surgical point of view. So the prostate having one anterior lobe, and this anterior lobe, it is situated in front of the prostatic urethra. On the posterior to the prostatic urethra, we can see the part of the prostate gland which is situated between the ejaculatory duct and the urethra, that is called as the median lobe. And the part of the prostate which is situated behind the prostatic urethra and below this ejaculatory duct, this portion, it is the posterior lobe of the prostate. And along with these three lobes, anterior lobe, median lobe, and posterior lobe, prostate also contains the two lateral lobes. These two lateral lobes we are not able to see here in the sagittal section, so that's why we move on to the coronal section of the prostate. So here in this figure with the coronal section, these two lobes are the lateral lobes of the prostate. What is the importance of these lobes of the prostate? This anterior lobe is devoid of glandular tissue, and that is why this anterior lobe, it is also called as the isthmus. This median lobe is responsible for formation of the uvula vesicae. That uvula vesicae is nothing but it is the part of the median lobe which projects inside the prostatic urethra from behind, and that will create the elevation within the prostatic urethra. And because of this elevation present within the prostatic urethra, it is going to form one crest, that is the urethral crest, as we have discussed in our the lecture of the urethra previously. This median lobe having so many glandular tissue, and at the time of the benign prostatic hypertrophy, in case of the old age, this median lobe is affected more frequently, and that's why the benign prostatic hypertrophy will lead to the compression of the urethra from behind, and that will lead to the dribbling of the urine or the retention of the urine. This posterior lobe of the prostate gland is more frequently affected in case of the carcinoma of the prostate. And this lateral two lobes, they're having abundant amount of the glandular tissue. So these lateral lobes, they are fused on the anterior side and part of the prostate gland. Without the glandular tissue in front, it represents the anterior lobe, as we have discussed. Now let's see the structures present within the prostate. There are three important structures which are present within the prostate, and the first most important thing is this dilated part of the urethra, and that is the prostatic urethra. So this prostatic urethra, it is going to be traversed through the prostate, and at the time of the enlargement of this median lobe, this prostatic urethra get compressed, and that will lead to the benign prostatic hypertrophy symptoms. The second thing which is situated within the prostate is this structure, and this one is the outpouching from the prostatic urethra, and that is called as the prostatic utricle. This prostatic utricle is homologous to the vagina of female, and this prostatic utricle opens inside the prostatic urethra from posterior side. The third structure which is present within the prostate is this duct, and this one is the ejaculatory duct. This ejaculatory duct is going to be formed by the duct of this vas deferens and the duct of the seminal vesicle. And this ejaculatory duct is going to open on each side of the opening of the prostatic utricle inside the colliculus seminalis. So for that, let's see this coronal section. So within this coronal section, this dilatation is called as the colliculus seminalis. Within it, we have three openings, and out of them, the center one is the opening for the prostatic utricle, and on each side, we find the opening of ejaculatory ducts. So there are three structures present within the prostate. The first one is the prostatic urethra, second one is the prostatic utricle, and the third one is the ejaculatory duct. Now let's move on to the capsules of prostate. When we see the capsule of the prostate, there are two types of the capsules are there. One is the true capsule and one is the false capsule. The true capsule, which is a part of the prostate gland itself, and it is going to be formed by the condensation of the parenchyma of the prostatic gland itself. And the second capsule, which is situated outside the gland, and that is going to be formed by the pelvic fascia, and that one is the false capsule. And this false capsule, it is continuous with the false capsule of the urinary bladder and going to enclose the bladder and the prostate in the same compartment. The important thing to understand here in this figure is that there is a venous plexus present between the true and the false capsule, and this is called as the prostatic venous plexus. So the prostatic venous plexus is situated between the true capsule and the false capsule in case of the prostate. While one another organ that is called as a thyroid gland, when we compare this prostatic venous plexus with the thyroid venous plexus, the thyroid venous plexus is situated deep to the true capsule. So for that, let's have some small figure for the understanding of the both the capsules. So let's compare the prostatic venous plexus with the thyroid venous plexus. So here in this case, the prostate having one false capsule and thyroid also having one false capsule. The false capsule of the thyroid is going to be formed by the pretracheal fascia. In case of the prostate, just under the false capsule, we find the prostatic venous plexus, which is covered by the true capsule of the prostate from inner side. While in case of the thyroid gland, just under the false capsule, we find the true capsule. And deep to the true capsule, we find the thyroid venous plexus. So the difference between the prostatic venous plexus and the thyroid venous plexus situation are important for the surgical point of view. At the time of the operative procedure, we need to preserve this prostatic venous plexus or thyroid venous plexus to prevent the profuse bleeding. If injury to this venous plexus is occur, it will lead to the abundant amount of the blood loss. So for the prevention of this blood loss during surgery, in case of the prostate, we have to enucleate the prostate from the inner side, and we have to keep the true capsule as well as the false capsule intact inside the body during removal of the prostate gland. While in case of the thyroid gland, we need to put incision between the true capsule and the false capsule, and that will preserve the thyroid venous plexus during operative procedure. So this is the major difference between the capsules of the prostate and the thyroid along with the venous plexuses of respective glands. So this is the very important point to understand. Now let's move on to the supports of the prostate gland. When we see the supports of the prostate gland, there are three important supports are there which we have to mention here. The first and important support to the prostate gland is this urogenital diaphragm, which is situated just below the prostate. The second support to this prostate is this fascia, and this one is the retrovesical fascia of Denon. And the third type of the support to the prostate is these ligaments, and these ligaments are the medial and the lateral puboprostatic ligaments. Now let's see the structure of the prostate. As we have already discussed, this prostate is the fibromusculoglandular organ, and this 1/4 part of this prostate gland is going to be formed by the fibrous tissue. 1/4 part of this prostate is going to be formed by the muscular tissue, and the remaining half part of this prostate is going to be formed by the glandular tissue. So when we draw the transverse section of the prostate, we can see that the prostate, it is just like this, and within it we find the prostatic urethra, which is having a crescent shape opening with the convexity on the anterior side. And as we have discussed, there are so many lobes are there, and out of them the anteriorly there is a glandular part, and that is called as the anterior lobe of the prostate, which is also called as isthmus. Just behind the prostatic urethra we find the median lobe, and just behind it we find the posterior lobe. On each side of the posterior lobe we have lateral lobes. So when we see the structure of the prostate, we find three types of the glands are there, and these three types of the glands include the mucosal gland, submucosal gland, and the main prostatic glands. Out of them, the mucosal glands, they are situated just near the mucosa, and they are going to open directly into the prostatic urethra. Just outside the mucosal gland, we find the submucosal glands, and these submucosal glands, they are going to drain into the prostatic urethra via the duct. And the outer part of the prostate having one main prostatic glands, and this main prostatic glands, they are the larger glands, and they having the branching ducts, and they fuse with each other and going to drain into the prostatic urethra. So there are three types of the glands are there. Mucosal glands, where they are situated to the inner aspect of the prostate. Just outside it we find the submucosal glands, and more outer side we find the main prostatic glands. The openings of these all the ducts into the prostatic sinus, they are at the different level. So for that, let's see the coronal section. So this is the coronal section of the prostate with the prostatic sinuses on each side of the prostatic crest. So all the glands of the prostate, they are going to open into the prostatic sinus. Out of them, the mucosal glands, they are going to open into the prostatic sinus above the colliculus seminalis. The submucosal glands, they are going to open at the level of the colliculus seminalis, while the main prostatic glands, they are going to open below the level of the colliculus seminalis. So this is the important understanding of the opening of the ducts of the different types of the glands of the prostate. Now let's see the arterial supply of this prostate gland. The prostate gland is going to be supplied by the inferior vesical artery, middle rectal artery, and the internal pudendal arteries. Now let's move on to the venous drainage of the prostate. It is very much important to understand. When we see the venous drainage of the prostate is going to be drained by the prostatic venous plexus, which is situated between the true and the false capsule, as we have already discussed. It is continuous with the vesical venous plexus above, and it also receives one vein that is called as a deep dorsal vein of the penis. This venous plexus, it is situated within the retropubic space of Vadgama. This prostatic venous plexus, it is going to drain into the internal iliac vein through the posterior ligament of the bladder. And one special route of the drainage of this prostatic venous plexus, it is within the vertebral venous plexus of the Batson, which is situated around the vertebral bodies. This prostatic venous plexus communicates with this vertebral venous plexus of the Batson via the pelvic sacral foramina. So at the time of the carcinoma of the prostate, the metastasis of this carcinoma prostate may lead to the carcinoma of the vertebral column as well as the carcinoma of the intracranial structures. So via this vertebral venous plexus of the Batson, the prostatic carcinoma may metastasize towards the vertebral column or towards the intracranial side. So the prostatic carcinoma may lead to the metastasis towards the vertebral column as well as the intracranial side via this vertebral venous plexus of Batson. The carcinoma of the prostate is rarely spread to the ampulla of the rectum, though the ampulla of the rectum, it is just behind the prostatic gland. And the structure which is responsible for the prevention of the spreading of the carcinoma of the prostate to the nearby ampulla of the rectum is this fascia, and this one is the retrovesical fascia of Denonvillus. So because of this retrovesical fascia of the Denonvillus, the carcinoma of the prostate is rarely spread to the ampulla of the rectum. Now let's move on to the nerve supply of this prostate gland. When we see the nerve supply of the prostate gland, it is via sympathetic fibers as well as the parasympathetic fibers. L1 and L2 spinal nerve are responsible for carrying the sympathetic fibers to the prostate gland via superior hypogastric plexus, while the parasympathetic supply to the prostate gland is via S2, S3 and S4 spinal nerve through the pelvic splanchnic nerve. So here this is all about the prostate gland with its clinical anatomy. Hope you understand well. Thanks for watching.